This is my audience. They're so beautiful. And I am Troy Vandament. And this is my demonstration speech. Okay. Scientists are in a non-stop battle against diseases such as cancer and diabetes. Although there is not a cure for either one of these diseases, there are many ways to make life a little bit better for people with these diseases. My mom was diagnosed with diabetes at the age of 30 after all her children had been born. This meant the risk of one of her kids getting diabetes was 1 in over 100. When I was 10 years old, I was experiencing symptoms of type 1 diabetes, and after a few days of continuous symptoms, we went to the hospital and I was diagnosed with type 1 diabetes, also known as juvenile diabetes. There are various causes and effects of diabetes, and there are also various ways to deal with diabetes. Type 2 diabetes is primarily passed down from generation to generation amongst family members. Like I said before, my mom had had diabetes since she was 30 years old, and that obviously would have played a role in me having the disease if it was type 2. Having a parent be diabetic is the primary cause for the child having it. However, it is not the only cause. Things like stress, diet, and even weather are factors. States with colder climates are known to have more diabetics in them than states with warmer climates. Living in Nebraska, this would make sense that played a role. I was never really a sweet tooth as a child, so diet probably didn't have much to do with me becoming diabetic. But stress, on the other hand, was vital to my diagnosis. A child can have diabetes for years before the symptoms fully come out in the open. My symptoms became in full effect shortly after the death of my oldest sister. The doctor said that was most likely the trigger factor to my diabetes. Like most any other disease, diabetes comes with its effects, both mental and physical. I remember as a kid having to carry around a needle and a bottle of insulin and taking a shot every time before I ate. I always felt both annoyed and a little embarrassed having to go to the nurse to take a shot before I would eat. There are a few ways to deal and better manage diabetes. One of those ways is the insulin pump. I'm going to demonstrate a little bit about how the pump works. This is the Medtronic MiniMed pump. There's various versions of pumps, but this is the one that I found works best for me. This here is called a silhouette. It's the first process to getting your pump set up. This is the needle that goes inside of you. There's two different sizes. This is the long one. I found that the short one kept falling out of me when I do active stuff, play basketball or whatever. So the long one worked a little bit better. But you just take the needle, and you take, I'm not actually going to put it in me because I already got one in me, but take a little piece of skin, put it at a 90-degree angle. Bam. Then you pull off the sticky part underneath, sticks to you. Pull out this side, sticks on you just like that. It can go anywhere. It can go in your butt, your stomach, your arms, pretty much wherever. This right here is a tube that runs from your body to the pump. Hooks in you just like this. Snaps in there just like that. So you got this cord. You can get different lengths with the cords too. There's like 16 inches, 24 inches. There's various ones. This is how you put the insulin into your pump right here. If I can figure out how it works. You got your bottle of insulin, and then this is called the reservoir, which carries your insulin. You fill up how many units you want of insulin. You fill it up with the air. Put the insulin bottle the right side up. Squirt the air in there. You can turn it upside down. That helps with the bubbles a little bit, putting the air in there first. Then you just pull out the insulin to how many units you want. There's 150 units right there. You get the bubbles out. Just like that. And there's your bottle of insulin. Just hooks into the end of the tube, or into the cord. And then slides right in here to the pump. And there's various settings that you can have it on. The first one is the bolus, which is the immediate insulin. Say if you're going out to eat, you type in how many grams you're eating and what your blood sugar is, and it just does the math for you, which is kind of nice. The next one is the basal rate. The basal rate is the, you can set and edit the temp, which is like, it's like a continuous flow of the insulin, like my body's producing itself basically. So just like over 3 hours, it'll give you like 2.5 units, and you can up that or you can lower it. Like if you're going to play a sport, you obviously want less insulin, so your blood sugar doesn't drop. If you're just laying around, you'd want more, so you can just edit that, which is nice. And then the prime, you can rewind it because there's a little extender in here that pushes the insulin out every time you add it in. You punch in 5 units, it pushes 5 units out until this is completely empty, and the hand gets to the end. Then you just rewind it and it comes all the way back and you start over. It's pretty nice. Diabetes affects millions of people, and new technology like an inhaler or an insulin implant are making it not only easier and more convenient, but also adding years to the lifespan of diabetics. And that concludes my demonstration speech.